Is this going to hurt? Is this a painful procedure during the procedure and after? Well, I explained to the patient that, we of course do everything with local anesthesia. We'll also use some medication to sedate the patient a bit so they're relaxed. That's very important. Keeps their blood pressure down so they don't bleed too much. Really, the only part of the procedure that a patient will experience any type of discomfort is when we do our initial, application of lidocaine. It's sort of like when you go to the dentist, you get, that first stick and there's a little pinch and a burn to it, but it's not, it's not horrible. So that's the truth of it. And then throughout the remainder of the process of the procedure, they should have zero pain. Zero pain. Now the question comes in, well, is it going to hurt afterwards? Well, some of that also depends on the type of procedure we're doing. Are we doing a strip excision procedure, or as is commonly known, an FUT, or are they doing FUE? Well, yeah, with an FUT or a strip excision, they're going to have some incisional discomfort. It's not like they have deep aching pain and it's horrible and they can't sleep. They're just going to know they have some stitches in place. We always will make sure they have a little bit of medication for pain, but it's not generally something that they're going to have agony and pain with. That's as far as a strip excision. They should actually be fine by the next day when they come in. I ask them, how do you feel? Having any pain? No, I feel fine. Which sometimes can be a problem because they end up getting a little too active, and then that can affect swelling and so forth. As far as an FUE procedure is concerned, really the only pain involved in that is that, the patient has to shave their head, and some people aren't so keen on that, and so it depends. It depends on what procedure best suits that particular patient. Maybe he's a high-level executive and he can't afford to have his, head shaved. So we might talk about the pros and cons of each and what fits the patient best. Again, a patient-first approach.